Hello everyone and welcome back to NeuroLab, the podcast where we explore fascinating ideas about brain, psychology and behavior. I'm your host Daniel. Today I'm thrilled to be joined online by Dr. Marcello Romei, connecting with us from Uruguay. He's one of the few dentists in his country who integrates hypnosis with dental treatment, and he's member of International Society of Hypnosis. Dr. Romei, welcome to NeuroLab, and it's a pleasure to have you with us.
Hello, everyone. Thank you, Daniel. The pleasure is mine.
Okay. To get us started, could you explain what is dental hypnosis and why you're interested in?
Well, it's a great question, a big question. Dental hypnosis is a tool as clinical hypnosis. For me, personally, it was a great discovery, I always sensed that something was missing in my career, in my professional career. And therefore, I always say that hypnosis found me instead the other way. So in that path, how can I say? Let's see, dental hypnosis is a technique that you use suggestion, you use to help your patients to deeply relax, to reduce fear, anxiety. In my case, I work a lot with pain. And that all is associated with dental procedures, So the motivation for its use is it's based on improving the patient's experience. And that allows you a more comfortable, more effective dental treatment. And therefore, it's an answer that requires a more deep interview maybe, but there are not so easy to explain issues, but in general, that's the point.
So, as you know, there is many myths about hypnosis. Could you explain about them and how can we differ from fact and myth about hypnosis?
That's a good one, Daniel. Well, movies and shows and arts and cinema and often depict the complete mind control, which is inaccurate. In our clinical practice, dental hypnosis helps the patient access their own state of relaxation and concentration, and that increases the cooperation and comfort between both. So control is not lost, and the person is always awake. The person can always interrupt the session, So that's the first great myth and difference between what people think it is.
So, my another question is about your work and your goal in dentistry. What is your primary goal in dental hypnosis?
Well, the first time I began with all this, it was mainly reducing anxiety and pain, and improve the patient cooperation and facilitate a longer, more complex procedure, maybe in surgery, maybe in other disciplines, and promote the patient a positive dental experience. That's the main goal. But of course, it's so big, it's so universal, so wide, the uses of clinical hypnotherapy, that it's growing much more than that.
Okay. Let's go deeper in dentistry procedure. In which procedure you can show most powerful effect of hypnosis?
Fortunately, in my discipline, which is high surgery and extractions and dental implants and root canals, oral surgery, hypnosis has shown positive results. So it has been mostly tested and anxiety and pain show a lower figures. So mainly is the promising results there.
Great overview. Let's dig into the science behind it. From a specific scientific overview, what do we believe happens in the brain when you use hypnosis?
Well, that's a more complex question to answer. In my training courses, I always have this kind of questions, and it's just one training course is not enough to respond it. But from a scientific perspective, hypnosis is believed to modify the brain activity, you know, the pain and the attention. As it is a deep relaxation state, it is inducing altered states. So the sensory perception and the emotional response to pain stimuli, that's the key to all this. So the last research show and suggest changes in brainwave activity, and as that happens, we are able to release endorphins. So that's the main scientific goal we found there, the discovery, you know.
Thanks for your explanation about the science of hypnosis. We want to go to your office, go closer to your procedure. Can you describe a typical hypnosis, dental hypnosis session from beginning to end?
Well, this is not just a recipe, but the main structure, the basic steps start with a deep conversation with the patient. You know, you establish a trusting relationship. From that point, then the patient is guided into a state of deep relaxation through verbal suggestion techniques, non-verbal body language, you know. So during this procedure, when the patient gets into the dental office, suggestions can be used to reduce pain, anxiety, to increase the feeling of control, and mostly breath work is very important there. And that's a basic structure in the dental chair.
I'm interested to know that what is your favorite induction technique?
Well, a lot of this have been taught. There's no just one technique, but of course I use not just one approach. For me, hypnosis, Daniel, is not separated. You know, my colleagues from science, from research, and clinicians always talk about what kind of hypnosis you develop, what kind of hypnosis you do. For me, it's just one matter. And it depends on the energy of the patient, you know. The challenge that you have is discover what kind of energy the patient is delivering you. Once you get the kind of energy, and once you sense it, then you can choose the right technique. You know, we have lots of hand drop, shake inductions, instantaneous, deep inductions, rapid inductions. Sometimes I mix them in a matter of 30 seconds. I can mix 3 or 4 techniques in one. You can put the side in the ceiling, the hand to the face. We use a lot of rapid inductions because the dental chair is still frightening for the patient. So you have to take it out of the space. You have to take the patient out of conscious. And so there's a lot of techniques that use the hands, ideomotor things are very well used there.
In your explanation, you said about patient energy.
Yep.
Could you explain more about and clarify what kind of energy, what mean?
Well, Victor Rausch, which is an old dentist that I've been in touch and learned a lot from him, was very famous about sensing the energy that the patient delivers to the dental office. So you remember the magnetic passes through the arm and maybe scan the gaze of the patient. And an energy is not just, how can I explain? The energy has to do with the mood and has to do with the type of patient you have. not just from the scientific point of view, because you can make a profile since you have Spiegel profile, whatever profile you use. But once you put that aside, you sense the kind of patient you have, in a sense that maybe it's a kinesthetic patient or visual patient or imaginative patient, and you have to sense that very from the beginning, right before everything starts. So when the patient is there sitting in the dental chair, you have to use your intuition, which is the language of unconscious, And once you get that information, the other kind of techniques and the way you treat the patient, it pops instantaneously.
So it's a kind of gut feeling.
Yeah, kind of that. And also maybe you have a patient which is blinking too much, the eyes, or shaking the body, or you have a patient which is already looking every piece of instrumental, everything you're doing it. So you have to sense if you have a patient A, B, or C, which is A, very kinesthetic, very nervous patient, which is always moving, or something in the middle, or just a pace patient, which is very tranquil, very easy. So in order to sense that, when you got the point, you just pick it's not just, picking the right technique. It's a combo, It's a lot of things you have to sense.
Yes.
How you work, how you talk to him, etc.
Yes. For fellow dentists who listening us, maybe they interested in what kind of training or qualification would they need to safely and effectively use hypnosis in their work?
Well, it's a good question.
How can they start?
Not everyone.
After this interview.
Yeah. Well, clinical hypnosis is not for everyone. You, as at the very beginning I told you, you can reach the hypnotic world from two sides, two paths, from pain and from your curiosity, But sometimes the both paths are mixed, because if you've been a patient traumatized with PTSD and you have a very traumatized experience when younger, then you can be curious about that. So you can start research. You can do your research like me, and start digging deep. And maybe for curiosity, and maybe from pain, you say, oh, well, what's this? What kind of tool is this? What kind of experience I have? Daniel, I always train some colleagues, and I told them, you have to experience this on your body, on yourself, prior to your patient, If you go through the hypnotic world on yourself, on your auto-hypnosis, on your trance, on your personal experience, then you're allowed to do it on someone else.
So, if I want to summarize your explanation, first they should start self-hypnosis and then use it for their patients.
Exactly. I understand that the research world from where you belong, and I have a lot of friends from the research world, and we always try to put bridges between both worlds, from clinicians and researchers. But I think we can nurture ourselves from each part of the world. So the future can include the development for standardized protocols, everything that you study and you do, which I read your books and all your friends. So integrate that with our clinic experience, then we can do the big picture, and explain better to our colleagues that want to learn or be trained.
Can you suggest some books for reading?
Oh, yeah, well, from the dentistry world, I have lots of books. This is one. Kay Thompson from Therapeutic Hypnosis. This is like the Bible for dentistry and for therapeutic communication. But you have lots of books right at my back. I have some interesting book. The last one I have is from Temple. This is from David Simmons, Catherine Potter, and Graham Temple. I don't know if you look at it.
It's blue.
It's okay for the... Oh, it's blue. Okay. We can... Okay. Oh, yeah. It's Hypnosis and Communication in Dental Practice. It's from Quintessence, David Simmons. These are two very good books, but of course, if you want to learn general hypnosis, you have plenty of literature. What can I say? Ericksonian books. I don't know. Right now, it kind of pops up, but any book that it's from Spiegel, David Spiegel books from Transfer Treatments is the best of its type. So fortunately, we have lots of good literature regarding this.
Let's talk about patients themselves. You said that we can't hypnotize everyone. Yes? So, who are the ideal candidates for dental hypnosis? Are there certain types of patients who benefit most or not?
Well, is it true that hypnosis it's not 100% effective in every patient, but everyone can be hypnotized? It is not a solution for severe behavioral problems or patients with psychological disorders, ex-schizophrenics, or patients with strong diseases, mental ones. But regarding the general patients, the best patients are people who work with numbers, like accountants. That kind of patients, it's very easy to hypnotize in the dental chair, at least in the dental chair. Of course, patients that come to the clinic, to the dental chair, are 50% already in trance, because they are shocked, because they are in pain. So the other part, the other half of the work, it's more easy for us because the dental patient comes to us in shock. So if you are in shock, you are very suggestible. So that would be the most easy patients.
Oh, thank you. Of course, no method is perfect for everyone and every situation. And I want to know about limitations of your work about hypnosis. What are some of limitations or cases where hypnosis might not be the best approach in dentistry?
Well, as I said recently, the best patients are with high levels of anxiety, dental phobia, or some needs for long or complex procedures. That's are the ideal candidates. But the worst patients or the worst limitations, the last months we've been working with a colleague with AHD, so the autism spectrum or syndrome, Down syndrome. These kind of patients are very difficult. They're a real challenge for us because we don't have their attention, just a quick 2 or 3 seconds, so we lose them. But I think we're trying, we're having good results on them. We are trying to combine some other tools like tapping, and we mix the tapping techniques with some inductions, hypnotic inductions, some breath work, and that kind of patients easily calm down, and somehow we're having good results in this kind of patients also. So it's very good.
So why you use a tapping technique? Is it for grabbing attention?
Yes, somehow this kind of patients that have limited attention and focus, narrowed attention, the tapping somehow attracts their attention while we are doing the hypnotic induction. So we're testing them every week because, they have a spectrum of attention. So we're testing them. Some of them respond very quick and some of them respond very slow. But in general, in the middle of this, we're doing well. My colleague from the other dental chair in the next door, she's using also AMDR. So we use also the bridge between hemispheres. And we're doing good results also there. So we're not close or narrow-minded to put all in the mix and use breath work and hypnotic induction. And some other patients react very positively and some don't. So we change, we switch, we shift from one technique to another. We're testing yet.
It's interesting. And what is your biggest challenge when you describe and discuss about hypnosis with your colleagues, dentistry community in your country?
That's a good one also. Well, the best and the big challenge here is to convince some colleagues, almost the older ones, and to put clinical hypnosis in the study programs of universities, because Uruguay, you know, Daniel, is still a very little tiny country. We don't have a structure in the school programs or university programs. So training of clinical hypnosis is something private. To be honest, I'm the only one in my country to do this. So you can imagine what is the great effort to be a pioneer doing this. You have to put the flag like in the moon. It's a tough work. It's a tough work to convince all the old professors and the old academics, because they still believe that hypnosis is like horror films or movies or whatever.
Let's go ahead and talk about future. What is your future perspective and what you want to achieve in future?
Yes, I think that my greater goal and challenge and future goals are, as I told you, develop the standard protocols, include clinical hypnosis into the academic university world, all the techniques and all the research in one place, and develop a new kind of way to train colleagues, and yes, build bridges between them, because now hypnosis and clinical hypnosis, it's not anymore an alternative tool, it's a complementary tool. So in the clinic, in the dental chair, in medicine, in psychology, in whatever discipline you can imagine, clinical hypnosis is a very powerful complementary tool right now.
Okay. Dr. Romei, thank you so much for joining us online and sharing your unique and valuable insights and perspectives. It's fascinating to see how hypnosis can improve dental experience and reduce fear and pain. For those watching this interview, if you are curious about learning more, check episode description. We put the helpful resources on there. That's it for today on NeuroLab. I'm Daniel. Thanks for listening. And until next time, stay curious about brain and mind.
Thank you, Daniel. Bye-bye.
Bye.